One of the most underreported stories in mainstream media, what the COVID pandemic mandates have done to our children. The lockdowns, mask mandates. Listen to a CBS reporter talk about this just the other day.
My kids hear me rant about this every day, so I may as well tell you guys. It's the crushing impact that our COVID policies have had on young kids and children. By far, the least serious risk for serious illness. But I mean, even teenagers, a healthy teenager has a 1 in a million chance of getting and dying from COVID, which is way lower than dying in a car wreck on a road trip.
The Surgeon General recently saying the nation has seen an increase in suicides at an alarming rate. Let's talk about this some more. I want to bring in Dr. Brian Stenzler. Dr. Brian Stenzler, thank you so much for joining us. So you're a healthcare provider, a concerned citizen, and most importantly, you are a dad. How dangerous is COVID-19 for children? Because just last week on MSNBC, Dr. Fauci said the statistics are being overblown when it comes to COVID-19 and kids being hospitalized. He said that they are hospitalized with COVID as opposed to because of COVID, meaning if a child goes to the hospital, they automatically get tested for COVID. So they may be there for a broken leg and they get counted as a COVID hospitalization.
Yeah, and on this, Dr. Fauci is right. It is definitely overblown with children. I think we know that. The American Academy of Pediatrics basically puts it at 0.003 to 0.003 chance of dying of COVID. And the CBS person that you heard before about car accidents, so much more, drowning more than 2-4 times the amount of opportunity to die from drowning as opposed to from COVID. So we know that this is definitely overblown, and it does not seem to be damaging for children to that extent where they have to do everything that they're doing, which I know we're talking about here with the mandatory masks and the lockdowns and the schooling from home. It's just a very overreaching try a way to fix something that is not a major problem right now.
Doctor, what effects are you seeing and hearing about, the mandatory masks and remote school learning? I know several parents whose children are in school in Los Angeles County, and as their kids are going back to school after the winter break, they've even shared emails with me saying that their schools are now recommending moving away from cloth masks to KN95s and N95s.
Well, it's interesting. They talk about the different masks. I mean, they're not even fitted properly. So you don't even know. Obviously, you're going to get more protection from that type of a mask. But you're dealing with children that are losing the ability to deal with facial cues, to see parents and teachers smiling. In August, Brown University did a study that basically showed that children that are, born during the pandemic have significantly reduced verbal, motor, and overall cognitive performance reduced compared to children born pre-pandemic. They're not connecting, like we said before. And then there's the potential damages of not breathing fresh air for so many hours on hours. So we're dealing with, the Surgeon General talked about the suicide rates being at the highest levels, isolation, anxiety, depression. I mean, this is a major issue for children mentally, where, again, like we said before, this is something where they're suffering. The children are suffering cognitively, socially. They're dealing with anxiety. Suicide rates are at an all-time high for the teenagers and above. So we know that this is not a very good situation with what's going on right now.
How badly have remote learning affected children of all ages?
Yeah, so kids are not being able to socialize. Like, I remember when I was at the beach with my son early on in the pandemic, and we were standing at the beach by the water, and he was like standing really far from these other kids. And it's just like, wow, even my own son, we don't do that in our house the same. So it's like they're not engaging with people the same way that they used to. Things are starting to get better in certain parts of the country. But when you're emotionally not able to connect with other children and with your teachers and then your family members, it messes them up big time. So they really need to get back into social opportunities, especially since it's not causing death for these children.
You recently published a book about helping parents raise kids for a lifetime of physical and mental health. What kinds of things do you address in your book?
Yeah, so the book is called Dream Wellness, the 5 Keys to Raising Kids for a Lifetime of Physical and Mental Health. And DREAM is an acronym for the 5 keys to a wellness lifestyle, being diet, relaxation, exercise, vegan adjustment, and mental wellness. And basically what we teach is that DREAM lifestyle helps children and, of course, adults adapt to chemical, physical, and emotional stressors. So this way the nervous system is functioning at the highest level possible. One of the big things that I talk about in the book is about salutogenesis, which is the creation of health, as opposed to pathogenesis, which is the creation of disease. We just lost the great John Madden recently, any NFL fans know, he always taught the X's and O's of football. Well, the X's and O's of immunology is X is about defense, O is offense. And everything that we've been talking about with the masks, with the social distancing, the medications, the shots, that's all defense. So at best, it keeps you from getting the pathogen, but it doesn't do anything for the offense, which gives you the opportunity to beat it. And that's one of the biggest issues that we have right now is we don't have a national strategy in getting our kids to be healthier, to avoid chemical, physical, and emotional stressors, to keep the nervous system functioning at a higher level. As a trained chiropractor, I think one of the greatest things that B.J. Palmer, the developer of chiropractic, said is that while other professions are concerned with changing the environment to suit a weakened body, chiropractic is concerned with strengthening the body to suit the environment. And that's something we need to start doing at a national level now, is doing things to eat right, exercise, have a great attitude, get the right amount of sleep, have a nervous system fully functioning, and all of the things that go with it. So this way, when you have a strong offense, you're more likely to protect yourself, because we all know, any sports fans know, that if your offense doesn't score more points than your defense, you end up losing the game.
Right before we go, what is your hope for our children in 2022?
Our hope is that they're able to function again as regular citizens, get out there and start socializing and being with other kids and just living a healthier, happier lifestyle.
Awesome. Dr. Brian Stenzler joining us from Florida. Thank you so much for being here.